Hi ladies, we're going to talk about breast implants and breast explants and all the stuff in between that your doctors are not telling you about, but you need to know about breast implant illness. Hi folks, it's Melissa here with Natural Health Resources, and if you are a follower of my YouTube channel, you'll know that I'm a naturopathic doctor and a lymphatic drainage therapist. And if you haven't followed my channel, I hope you will today. I want to talk to you about a topic that I see every day in my practice. I have women coming into my practice initially with swollen lymph nodes or feeling fatigued and run down. And a lot of times they get referred to me by their doctors or their friends or have found me through searching on YouTube or the internet. However they find me, what I end up uncovering and unearthing with them and their doctor community is that they are suffering from a silent illness that is starting to become a little bit more mainstream. It's called breast implant illness. This video is part of my Natural Breast Health series, and it might not apply to all my viewers, traditional viewers that are watching this, but I know it's going to apply to somebody in your life and it might impact you directly. And if it does, I hope that you consider this video a big hug and a validation. And I want you to know that you're not alone and that there are options and resources and a lot of great information and tools for you to lead a healthy life and to get back to normal. As a lymphatic drainage therapist, I'm a specialist in surgical healing. I'm a specialist in minimizing swollen lymph nodes and moving the lymphatics. And a lot of times I have plastic surgeons that are doing breast implants that are sending their patients to me for post-surgical healing. And I have a surgical guide, I'll link up above to that. But what I find is that they start to get, and it's been more frequently, more common more frequently, and I don't know if it's a particular type of manufacturer, I don't have those details, but if you're watching this video, I'm sure you're at the right time at the right place because you are not dealing with symptoms that are just in your head, okay? And the reality of the symptoms, it spans 4 to 5 different systems in your body. The illness, once you get your implants, can be triggered by your genes. Some folks have methylation issues. Other folks have already pre-existing autoimmune disorders that haven't been unearthed. Other folks have hormonal imbalances or are toxic anyway, and you add a breast implant that has silicone, it might have saline in it, and it just sets things off. The systems that get involved are metabolic, they're neurological, they're endocrine, they're immune, and they're also your digestive and your gastrointestinal tract. That spans your whole entire body. And your hair, a lot of women come to me and they're losing their hair. Literally, they'll get off my table and it's like they're like my chemo patients where they're just losing lots of hair. Others are swollen, like their necks are really holding a lot of fluid. Some gain 20, 30 pounds of weight 2 or 3 years after the breast implant. Others have really deep hormonal imbalances. The actual encasing of our saline breast implants, silicone by nature is an endocrine disruptor, and your endocrine system is your hormone balancing. That affects everything, your stress hormones, your ability to manage your normal stress in everyday life, and even your immune system. So what you're experiencing, I want to tell you, it's real. I believe you, and there are more and more doctors that I'm working with that are doing explants. So if you are a woman considering breast implants, I hope you will take heed. And if you're a woman who has breast implants, and especially if they're past the expiration, usually you want to look at 8 to 10 years of getting a new implant. If you haven't done that, there's a good possibility that your autoimmune system is reacting to the breast implant in your body. And that immune reaction causes inflammation, and it causes endocrine disruption, and it causes all of these symptoms from fatigue to muscle loss to cognitive brain fog. Like you put your keys down, you can't remember where they were, or you forget your child's name or how to drive to work. It's serious. And it is something we need to talk more about in our society. My practice primarily is based in Florida. I have a lot of plastic surgery patients. I work hand in hand with awesome, wonderful, caring plastic surgeons. They're doing breast reconstruction with a lot of cancer patients. They're doing Brazilian butt lifts on women who want to look like J-Lo and Kim Kardashian. And they're also doing breast implants. And they're doing it because the market is dictating that they need to do it. And they need to make money to survive just like all of us. So you can't always fault the doctor. But as a consumer, it's really important that you know your information and you get educated. And as a naturopathic doctor, I look at the root cause of illness and disease. And so when women come to me and they're swollen under the armpit and they want lymphatic drainage because they're just feeling like, gosh, you know, I haven't really fully recovered from my breast implant surgery 4 or 5 years ago and I'm swollen, we start to unearth all these things. I do different types of tests with women, and there are some men that are getting breast implants, but primarily it's women that are dealing with this. My men that might be getting chest implants or calf implants, those are sometimes a little bit of a different situation. But anytime you're putting a foreign substance, a foreign entity into your body, there's always a risk that your body's going to reject it. We hear about people getting heart transplants and then the rejection therapy. There's no rejection therapy for a breast implant, is there? Did they talk to you about that when you went into the doctor's office? Hell no. Did they tell you all about the women that call up 2 or 3 months later and complain? Certainly they don't. And they won't. They'll never put it in the pretty book of all these beautiful bodies and happy women. And no, they don't. And many of them are not tuned in. And as a naturopathic doctor and a lymphatic drainage therapist, I try to educate as many of my surgical referral partners. I have explant doctors I work with. And I think it's really important, if you are a woman considering getting your breast implants out, that you do your diligence. I'm going to tell you, I know of 7 to 8 highly trained, qualified, amazing explant doctors. And then there are others that are doing it. But you want somebody who's going to take out the whole entire capsule. And if you're familiar with the term capsular encapsulation, there could be a lot of scar tissue and a lot of inflammation in that actual breast implant and in the space around the breast tissue. Your explant surgery is going to take longer than your breast implant because there's sometimes scar tissue to remove. There's kind of internal working. Some of my women, they actually have the breast implants deflate and this stuff kind of moves around and you get scarring and it's not easy. And so ask questions. You want to find out, how long is the surgery going to take? How many have you done? What do you analyze the breast implant? There are doctors I work with that are actually testing what is coming out of your body. And you know what? It validates everything you're experiencing. Some of the breast implants have mold. No joke. They have mold. Oh my God, you have mold in your body. They have foreign substances. Some have had stuff in there that we don't even know what it is. Like, what is going on? So, ladies, I want you to be really conscious of getting a breast implant and then being conscious of removing it. And I'm here to just educate, but I know there's a big societal pressure to look a certain way and to look voluptuous. And for many of my breast cancer survivors, they've just gone through hell and back and they want to look like women and feel feminine again, because that is how our brains work. That's how the male mind sees the body as a female. And it's how we often identify ourselves. Who are we? We are women with breasts and we're feminine and we're mature. And that is a psychological pattern that is often not conducive to a healthy body. And I know it's going to be something that's really hard for many people to grapple with. But would you rather choose? Would you rather choose health and feeling great? Or would you rather choose deteriorating health for a certain body type or image? And we're all aging. We can't turn the clock back, but we can give our body a healthy lifestyle. We can give it a healthy environment. And so what I wanted to do today is to really just educate and really affirm and confirm that if you came to this video, you're doing research. And there are some great Facebook groups that I want you to check out that communicate more about this. I'm not personally affected by this, but I work with women that are. And when they come to me, they're very upset, and it makes my heart cry, because they are just wonderful, beautiful women, and now their bodies are rejecting this implant, and it's so hard for them to even figure out what is going on. And you go to your doctor, and honestly, they come to me and they've seen 8 or 9 specialists, and they're like, oh, it's in your head. No, it's in your breast. It is there, and it's causing an illness, and it's something that's really important for us to talk more about. And so I'll tell you a little story. I worked with a particular client who had been dealing with all sorts of stuff. Anxiety, she had depression, she was nearly suicidal at one point. She gained 25 to 30 pounds at one point because of thyroid imbalances. She had weird skin rashes that were unexplained, lots of swollen lymph nodes, not just up in the upper quadrant, but she had inguinal, right where the leg and the hip meet. Those lymph nodes were swollen. She had high levels of cortisol, that's our stress hormone. Just a lot of the traditional symptoms. Had lost a lot of hair. That goes back to the whole thyroid thing. Her adrenals were not operating at their optimum. And we talked before she had her surgery. And as a lymphatic therapist, I actually like to do some lymph clearing and cleaning so that we can get you ready. I have a whole post-surgical guide I put all my clients that I see in face-to-face through. It's an 18-week program, 2 or 3 weeks before, and then right after you get out of surgery, a few days later, a week, and it kind of staggers your healing needs. It's actually available online. I'll link up above, but I'm also going to put a link down below. It's a great guide because what it does is it allows the body to easily transition and begin that detoxing process. And within 4 months of her explant surgery, we were seeing significant results. We are talking, she was dropping weight, her body started to self-correct, the hormones were starting to rebalance, she started decreasing her thyroid medication requirements, her skin immediately changed, fatigue started to lift, the brain fog, the neurological aspect for her particularly was a lot harder to recover. And that's something too. Some people genetically are more susceptible to the silicone disruption. Silicone actually just affects our neurotransmitters and the way the brain's kind of processing and signaling that's going on throughout the whole body. So everybody is going to deal with this differently, but the long term is that there is a healing process and a healing program that you can be a part of. The surgeons that will put you in the best care are those that are doing explants all the time. You want to definitely make sure you're working with somebody that can remove the whole entire capsule in its entity and however it's formed in your body, so that you can come out of this on the upswing, on the upside of healing. So I hope this was helpful. Please stay tuned for more videos. I'm going to link to some other breast health videos in this series. And I actually have a ton of really great free guides that I want to get you a part of. I have a breast health course. So all of that information will be down below and a link up above. But I just wanted to tell you, you're not alone. It's not in your head. This is a real illness. And the medical community is starting to become more aware of it. But your voice needs to be heard. And I hope that you take care. If I can help you in any way, please let me know. So my goal is to have a community where we uplift each other and communicate and educate each other. So if you found this helpful, please give me a thumbs up. Sharing is caring. Please spread the word. If you find there is somebody in your life that could benefit from this, I do encourage you to share. Stay tuned to more great videos. I appreciate your time and have a wonderful, healthy, happy day. You deserve it.